Good morning, everybody, and welcome to Monday morning with Pinnacle People Solutions. It's a little bit chilly here in Armidale this morning, I must say. I think it got down to about 5 degrees overnight. So I think the autumn and winter is starting to be felt. Good morning to those of you joining us for the first time and to those who've become regulars since we started this process Thursday week ago. So my name's Bronwyn Pearson. I'm from Pinnacle People Solutions and welcome to our daily Facebook Live update. Pinnacle People Solutions provides human resource services and solutions to regionally based, small to medium enterprises and not-for-profit organisations. And we're here to help you in your business through these challenging times with COVID-19. So I will be live at 9:15 every weekday with updates on new information and more detailed information about topics related to staffing and business development. Please ask any questions you have as we go along. And I will do my best to answer those. I might need to take some on notice, or if they come in late in the session, I might need to answer them the following day, but I will most definitely do that for you. Outside of this, of course, you can contact myself and my wonderful team anytime via Facebook, Facebook Messenger, etc., email or telephone, and our information will be being put up, as it always is, by my wonderful team shortly, so you'll have that detail in the comments. Good morning, Naomi. Thank you so much for joining us this morning. So some of the breaking news or sort of changes that have been foreshadowed or announced since Friday, because obviously we've had a weekend in the meantime, is we've got the government ministers being returned to Canberra on Wednesday to consider the $130+ billion wage subsidy package that the Prime Minister announced last week. And there has been quite a bit of pressure from Labor and the ACTU in terms of that program or subsidy giving wider coverage to employees than it currently does, particularly in the area of casuals. So what we do know is that there are discussions going on at the moment. It's quite possible that negotiation could add another $5 billion to the scheme, and it'll obviously go to Parliament for a vote on Wednesday. We will actually be devoting our Thursday morning live stream to unpacking the legislation, assuming that it's that we have the details by then. But what we do understand is that the government will expand the definition of people who can qualify for the new JobKeeper subsidy of $1,500 a fortnight when they've worked for multiple employers over the past year. So they had said that the criteria for casuals getting access was that they had to be with the same employer for 12 months. But we understand that the Minister is reconsidering that definition and may allow casuals who work for multiple employers in that 12-month period to be eligible. And obviously we do know that permanent employees qualify for the scheme as long as they were on your employer books by the 1st of March 2020. The government is still intending at this stage to pursue temporary changes to the Fair Work Act to allow employers to pay people the base amount of $1,500 a fortnight, even if their usual salaries are higher. The unions are keen for that to be award amendments rather than act amendments, but the Minister seems fairly convinced about making it that change to the Fair Work Act. So we'll wait and watch that space with some interest. I mentioned last week that the Fair Work Commission has proposed changes to 103 of the modern awards to provide unpaid pandemic leave and annual leave on half pay. Now, those changes could be introduced as early as this coming Wednesday, and they would operate until the 30th of June. So just watch this space. We'll be sure to communicate with you further about that as soon as we know more, which should be later this week. So need to know information for today. We've had 37 deaths in Australia, over 5,600 cases nationally. 10% of the coronavirus cases identified are due to community transmission, and that's certainly that, and hospital admissions are the two measures that the government are paying, or all governments are paying particular attention to help make their decisions about whether we get further restrictions in place or not. There's been an announcement by the New South Wales Police Commissioner that a criminal investigation will be undertaken into the issues around the Ruby Princess cruise ship. Victoria has announced that they will sponsor free accommodation for healthcare workers who need to isolate. WA has closed its borders for up to 6 months. South Australia's records are the best result in 3 weeks. A Tasmanian hospital in Burnie, in the north of the state, has shut down 2 wards after 3 staff tested positive to coronavirus. And obviously, as I foreshadowed before, the federal parliament will be voting on that 3rd round of stimulus measures on Wednesday, which is essentially the JobKeeper and associated initiatives. So, and hopefully we'll be in a position on Thursday morning's broadcast to give you all the latest on that. That should provide us with the detail as to eligibility and how organisations may need to demonstrate their eligibility and so forth. So on to today's spotlight topic. And today we're talking about all things workers' compensation and COVID-19. There's a whole range of material here, and we will provide you with some fact sheet information which will go up on our website, as well as information in the comments as they come to hand. So I guess firstly what I would say to you as an employer is, in this particular area, it's incredibly important to make sure first up that you have a work health and safety policy and an epidemic and pandemic policy and procedures in place. That's at minimum. This is a time when policy and procedure might ordinarily seem like an add-on or a luxury, but really it's at times like this that they become very fundamental to how your business operates. We can obviously talk to you further about your obligations in that regard and assist you with policy development. So your first obligation for employers that you should, in consultation with your workers and any other businesses that work in the same workspace as you, is to identify work and work activities that are at greatest risk of spreading infectious diseases in the event of a pandemic. For example, if your business is one where you have employees in clinical roles or that work in clinical settings, border control, face-to-face customer service as examples. You need to have assessed the likelihood and consequences of infection to workers and others in the workplace, and put in place minimisation strategies as far as you can. You may need expert advice in this regard, and please reach out if you do. It's very important to encourage your workers to remain away from work when they're unwell, and you can actually require that. It's important to develop an implementation plan if you have somebody who tests positive, and continue to monitor expert advice as the situation develops. And obviously we'll keep you up to date via these live streams on things that are developing and your obligations. It's really important to continue to educate and keep your staff and any other people who visit your workplace up to date on new information, and to consult with others with whom your business works, so contractors, labour hire providers, to ensure they're also being active to the extent necessary in managing the risks associated with this situation. So in terms of what might be necessary changes to your workplace practices, it's, as I said, really important for you to, as an employer, to identify the hazards in your workplace, and those associated with the way work is performed. Now, it could be that the way that your work is performed has changed radically in the last few weeks. You might have people working remotely. You might be doing things quite differently to how you would normally do it. So it's important that you are assessing and reassessing risks as those changes happen. It's important that you implement suitable control measures to first eliminate, and if eliminate isn't possible, minimise risks. So instructing workers to stay at home if they're sick, even if any of the following symptoms are mild. And these are things like fever, dry cough, sore throat, fatigue, shortness of breath, headaches, aches and pains, and fatigue. Maintaining a distance of 1.5 metres between workers and customers, as well as moving workstations apart more than 1.5 metres. This is where you've still got people working together in a work environment. Any unwell workers need to be instructed to seek immediate medical assistance. Designing work activities to reduce physical proximity of staff, and or encouraging social distancing through flexible work arrangements like working in different locations. You want to reduce or eliminate altogether non-essential face-to-face meetings and gatherings, and promote the use of virtual communication channels like phone and video conferencing, etc. It's also really important to reinforce and support good personal hygiene, including good hand and respiratory hygiene, and that doesn't matter where your staff are working for you. If they're working from home or whether they're working in some kind of designated office space outside of the home, you still need to really importantly reinforce and support good personal hygiene. So you need to, it's really important that you consult with employees and other businesses that have duties in relation to the work or the workplace. You might hold meetings with staff to discuss possible control measures, talk to neighbouring businesses about what you're doing to manage risk if you're all co-located, provide information, instruction, training or supervision as might be necessary to protect people from risk to their health. And that would be also in providing any information about changes to work arrangements. So if you've got people working remotely from their normal place of business, add to that policy list that you should have a working remotely policy and appropriate checklists in place for staff to be able to assess their own work environments, provide photographs, etc., so that you as the business owner can be assured that their work environment is safe and poses limited or minimal risk. You do need to monitor the health of your staff at all their workplaces, including at home. So while you physically can't be there, you need to be having very frequent communication and checking in on their physical and mental well-being. Make sure that's particularly important, to make sure that there's effective communication when you've got staff working remotely. As employees, for those of you who are employees of an organisation who've joined us this morning or who are watching this afterwards, please, you need to take reasonable care for your own health. Your job is to take reasonable care that your acts or omissions don't adversely affect the health and safety of other people, which is why we're all being encouraged to stay at home unless there's an absolute necessity, essential reason for travel. Comply as far as you're reasonably able with any reasonable instruction that's given by your business, and cooperate with any reasonable policy or procedure of the business relating to health at the workplace that's been notified to you. So they are your responsibilities as employees. So some specific examples are staff, everyone, employees and employers should be frequently washing hands with soap and water for at least 20 seconds or using an alcohol-based hand rub. Certainly the soap and water is the best option, an alcohol-based hand rub if you don't have that. When coughing and sneezing, obviously cough into your upper sleeve and shoulder or a disposable tissue. Dispose of tissues immediately and use alcohol-based hand sanitizer after disposing. If you're unwell, avoid contact with others. So shaking hands, touching faces, hugging, any other kind of intimate contact, and maintain vigilance for example, don't take a night off to mix it with the crowds in an unprotected way. So, or see people you wouldn't ordinarily see. For employers, the responsibilities there include establishing a customary non-contact greeting. That might be, the suggestion is bowing, but you could find other ways, I'm sure. You need to display information promoting the non-contact greeting so visitors feel at ease. If you've got a workplace that everybody is still working, albeit at appropriate social distancing measures, consider installing high efficiency air filters and increasing ventilation rates in the work environment, including negative pressure ventilation. Consider installing physical barriers such as clear plastic sneeze guards. Make sure that everybody's frequently hand washing. Make hand sanitizer dispensers available in prominent places. Make sure that everybody has access to facilities where they can wash their hands with soap and water. Regularly change that soap or use liquid pump soap. Ensure an adequate supply of paper tissues is available. Make sure you're wiping down high-touch surfaces with disinfectant regularly. And ensuring infection control procedures are reviewed to make sure that the cleaning staff and those who need to have access to personal protective equipment like gloves, gowns, professionally fitted masks, eye protection, respirators, etc. are all available. Make sure you've got adequate supplies of cleaning equipment and PPE. And obviously actively promote good respiratory and other hygiene in prominent places where customers or work contact is likely to occur. Discourage staff from using each other's phones or desks or offices or work tools or equipment where possible. Restrict the number of people entering isolation areas. And establish alternating days or extra shifts that reduce the total number of staff in a facility at a given time, allowing them to maintain distance from one another while maintaining a full on-site work week. Discontinue non-essential travel. Depending on the nature of work, train employees who need to use PPE on how to do it properly. There's nothing worse than having PPE which isn't appropriately fitted. Establish a discipline regime for non-compliant workers. So make sure that you've got clear verbal warnings, training, written warnings, show cause proceedings and dismissal if necessary. These are really serious times, and as employers, it's incredibly important that we are showing appropriate leadership and that we're taking appropriate action if things aren't being done in the way that they need to be done. So do you have a response plan if one of your staff presents with COVID-19? We all need to have a response plan if an employee presents with COVID-19 in consultation with workers, considering obviously up-to-date government health advice. So that would involve the worker, anybody they were exposed to, whether they were exposed in the work environment, and you would need to involve their Department of Health in those arrangements. So you also should have a plan that records those who become ill and leave the workplace and the people they've had close or casual contact with, and what to do when a person with a suspected infection has left the workplace. So ensuring their workstation, work area and communal areas that they've been in are thoroughly cleaned and disinfected. Those are really the sort of established things that you need to put in place as employers to make sure that you're covering your daily health and safety obligations to your staff. It's incredibly important that you're on the front foot. You are responsible at the end of the day, lawfully and legally, as to your health and safety obligations, and it's incredibly important that you're seen and being seen to do all of those things. We can obviously help you with any of the specifics of that, so don't hesitate to reach out if there's things that we can support you with. Now, I just want to get down into some of the nitty-gritty around workers' compensation specifically, because this was more around work health and safety as a non-tray, and that is just to question and answer some things that have come through for you. And the first around workers' compensation is actually around policy and premiums. So one of the questions we've had is, I've had to reduce staff or shut down due to COVID-19. How does this affect my policy and my premium? So in the first instance, we'd encourage you to reach out to iCare in New South Wales to discuss how they can best support you and your policy needs. They may be able to reduce your wages and coverage to reflect your new circumstances. They may be able to refund you the unused portion of your premium while keeping your policy active in readiness for when you return to business. If you're eligible for a refund on your premium, iCare will issue you your refund within 1 week of adjusting your wages, provided no other premium amounts are outstanding. And they can consider deferring your premium payments for up to 6 months if you're experiencing financial hardship. So that's good and important for employers to know. So there was another person who had to shut down their business due to COVID-19, but they still continued to receive overdue payment notices from iCare, and they've asked what should they do. If you have, as a business owner, already contacted iCare to discuss your circumstances and they've deferred payment of your premium, just disregard any overdue payment notices that you get in the meantime. These are automated from iCare, and they actually don't require you from any action, assuming that you have contacted iCare and come to an arrangement with them. So in terms of workers' compensations claims, and this is some of the information we've had the most questions on, one of the questions we've had numerous times is, am I liable if my worker contracts COVID-19? And the answer to that is that in some circumstances, coronavirus may be a compensable workplace injury, as disease is included in the definition of injury under the Workers' Compensation Act. But to be compensable, so to be able to put in a successful claim, work activities must be proven to be the main contributing factor to contracting the virus. Due to the nature of viruses, of course, it may be difficult to determine that employment was the main contributing factor, but each claim would be assessed on its individual merits. Obviously, there would be some, at this stage, Australian authorities are being very vigilant about trying to narrow down the source of infection for every case of COVID-19. Obviously, those 10% of cases that are community transmission, it's not been possible to necessarily identify where the source of infection was. But in the event that authorities can do that, and it's determined that your worker contracted the virus in the process of doing their work for you, then the chances are it would be a compensable injury. So where medical evidence confirms that someone's been diagnosed with COVID-19, there are two likely scenarios for compensation for loss of earnings and/or medical and treatment expenses. Where the worker asserts that the virus was contracted in the course of their employment through contact with someone who has the virus or contact with virus particles on a surface, or where the worker asserts the virus was contracted in the course of employment in the above circumstances and the virus has aggravated a pre-existing underlying condition, for example, if they have an underlying respiratory illness, for example. They're the two medical evidence situations that would be associated with a claim. So what evidence of investigation or investigations are required when assessing a claim for COVID-19? So iCare would be asking for evidence to confirm both the diagnosis and information to support how the diagnosis is related to work. So they'd be asking for that information if a claim came in. A certificate of capacity confirming a diagnosis of COVID-19 would be required, as well as information from you as the employer, the worker, and a nominated treating doctor in relation to how COVID-19 was contracted. This information must demonstrate that employment was the main contributing factor to the worker contracting the virus. If, however, a certificate of capacity can't be obtained due to quarantine restrictions, other information that confirms a diagnosis of COVID-19 may be considered. Okay, so one of the other questions we've had, I've received a claim where the worker has been asked to self-isolate due to work-related exposure to COVID-19, but has not been diagnosed with COVID-19. What should I do? If the worker has been sent home because of potential exposure to coronavirus, they don't show symptoms while in isolation or test positive for COVID-19, then workers' compensation will not be payable. If they do show symptoms and test positive for COVID-19, then they'll still need to satisfy the claims service provider that exposure in the workplace was the main contributing cause of their illness for workers' compensation to be paid. I have received a claim where the worker has been asked to self-isolate due to exposure to COVID-19 in the community, so not related to work, but has not been diagnosed with COVID-19. What should I do? This circumstance does not meet the definition of an injury under workers' compensation, and entitlements would not be paid under workers' compensation in those circumstances. So that's very clear. In terms of what leave they might be able to take, one of the things that we'll know this week is whether the Fair Work Commission's intention to proceed to enable unpaid pandemic leave of 2 weeks will come into the majority of modern awards. If that happens and you've got staff who are award covered, talk to us, because there may be other options there, but certainly it wouldn't meet the definition of an injury under workers' comp. Okay, one of the other questions we've had, I have received a claim where the worker has been asked to self-isolate. I have received a claim for psychological injury as a result of mental health issues arising from the worker being stood down due to business changes as a result of COVID-19. Would this type of claim be accepted? The answer to that question is the claim would not be covered. So compensation is not payable as a result of psychological injury that arose from reasonable actions taken by an employer in relation to promotion, demotion, transfer, dismissal, or the provision of employment benefits to the worker. So each claim would be assessed on a case-by-case basis. Is a worker able to obtain or able to claim workers' compensation if they're injured whilst working at home? Big ticket question at the moment, which we've had many times in the last few weeks, as you can appreciate, with the volume of businesses that are working remotely. A worker may be able to claim for injuries sustained while working from home or another remote location, and compensation may well be payable. In order for the claim to be accepted, there must be evidence that the worker has sustained an injury arising out of or in the course of employment, and that their work was a substantial contributing factor to the injury. Employers, you continue to have a responsibility to ensure workers have a safe environment to work in, even when at home and in other locations away from your normal workplace, which is why I talked before about very important for you to have a working remotely policy and an ergonomic and workstation setup checklist, including the staff member taking photographs of where they will be working routinely and sending them to you with the checklist, so that you can be sure that their environment is providing a healthy and safe place for them to work. So we need to encourage our workers to create a safe work environment whilst working remotely, and this includes making sure that it's appropriate ergonomically and in an area free of trip hazards with adequate lighting. We also need to encourage our staff to take extra care for their personal safety whilst at home, just as they would in their normal workplace. If a worker is working, this is another question, if a worker is working from home and decides to work at an alternate address, such as a friend or colleague's house, would they still be covered for workers' comp? Yes, they would. The same principles would apply as if they were working in their own home. In order for the claim to be accepted, there must be evidence that the worker has sustained an injury arising out of or in the course of their employment, and that employment is a substantial contributing factor to the injury. Where the worker can show that the nature or requirements of their work played a substantial role in an injury that occurred whilst they were either at home or at another location where they were working remotely, then their injury will be covered under workers' compensation. This reminds us of how important it is for there to be regular ongoing communication with your workforce where they're working remotely, and also to require your staff to advise you if their work takes them to another location other than the one that you've approved and had checklisted. If a worker, now I've got a few more questions here and it's 9:45, so I'll get through as many as I can before we finish up today. Others I will deal with in the next Q&A. One of the other questions that we've had, if a worker comes into contact with a person with COVID-19 whilst working from home, can they make a claim? Contracting COVID-19 can constitute an injury under workers' compensation because a disease is included, which we've already talked about under the Workers' Compensation Act 87. However, again, work must be proven to be the main contributing factor to contracting the virus. The test is the same whether working from an office or from home, and for a claim to be accepted, the staff member would still need to establish they had contracted COVID-19 because of their employment, and work activities must be proven to be the main contributing factor to contracting the virus, and obviously each claim would be assessed on its own merits. Okay, it is now 9:46, so I'm officially a minute past our live stream today. I will deal with the other questions that we've had around workers' comp at our next session. Tomorrow, though, we actually have Jessica Pearson, our consultant psychologist, providing a session on ways to maintain a good routine during social isolation, and God knows we've had lots of questions about that also, so that's a timely topic for tomorrow. I guess the what to do next in terms of today's topic is check whether you have appropriate policies and guidelines in place, and if you don't, get them sorted. Work health and safety policy, epidemic and pandemic policy, working remotely, and the associated checklists are top priority for that. Talk to your staff about hygiene practices, how to be mindful of their own and others' health and safety. Consider any feedback and suggestions they have on how to improve things. Implement changes to practice and policy as you go, as you need to. Get advice from us if you need to do that and you're not quite sure. We're always here to help. Contact us anytime, and the contact information has been put up by my lovely team in the comments today. If you have specific questions about your business situation, or you want us to help you out, obviously contact us anytime. Jess will be up tomorrow to talk about ways to maintain a good routine during social isolation. So please invite your colleagues and friends to join us. Thank you to those who are joining us again, and those who are new to our broadcast. We'll see you again tomorrow morning. Wash your hands, stay safe, stay at home. I'll see you again on Wednesday. You'll see Jess tomorrow. And in the meantime, any questions, etc., please flick them through to us and we will answer them in the next broadcast. We will also have today's live stream available for viewing up on Facebook, YouTube and LinkedIn. Many thanks to you all, and take care, and I will see you on Wednesday. Thank you very much.